Let's now shift our focus to Karnataka. From tonight, Karnataka will observe a 2-week shutdown in a bid to break the chain of COVID infections. The state has seen a huge spike in COVID-19 cases that has completely overwhelmed the system. Maya Sharma joins us with the very latest. Maya, Karnataka is going into a lockdown for a period of 14 days. What's going to be open? What's going to be shut? Bring us up to speed with the latest.
Essential shops will remain open during the 2-week lockdown. From between 6 a.m. to 10 a.m., all essential shops and services will be open. But after 10 a.m., they will have to stay shut. Public transport is going to be off the road. Only trains and airplanes will actually be able to travel into and out of the state. And there was a big crowd actually seen at bus stations last night as people tried to head home. They were given last night and today to actually reach their home. They said many people actually preferred to leave Bengaluru and other big cities and head to their home during the time of lockdown. So for people traveling to catch flight and train tickets, their tickets will actually serve as passes for movement. Only emergency travel within the state is permitted. The metro will also not function in Bengaluru. For restaurants, only take-home or home delivery orders of food will be allowed. Agricultural, manufacturing and construction activities are permitted, but garment factories must stay closed. Banks and ATMs can function. Weddings are limited to 50 people, funerals to only 5 people, but vaccinations are permitted as is testing. But of course, people are actually questioning how do they get there if there is no public transport. People are allowed to go to vaccinations and for testing by showing minimal proof. But the question of how to get there is, of course, a big question. There was a drop in the new cases reported in the latest data released on Monday night, but that doesn't mean the figures are low. It's still over 29,000 new cases for Karnataka and over 16,000 new cases for Bengaluru. ICU beds remain in short supply. Oxygen is still a struggle for patients and their families. And the state is in the process of setting up thousands of emergency ICU beds, 2,000 in Bengaluru, 2,500 elsewhere in the state. And this lockdown, this 2-week lockdown, really a bid to try desperately to break the chain to help the overwhelmed health infrastructure.
All right, ma'am, I appreciate you for joining us with the very latest. The situation there in Karnataka continues to remain grim. State is going into a 14-day lockdown starting tonight.